All right, you guys asked for it. A doctor-level deep dive into anesthesia and myopathies in horses. So to really get into it, we're going straight to a recent article. Anesthesia and Myopathies of Horses.
Sounds like a plan.
It's by Douglas Castro and Stuart Clark Price, published in Veterinary Clinics. Equine practice just this year. Now, this topic is obviously crucial for anyone working with horses, especially those in the veterinary field.
Yeah, it's something you absolutely have to have a handle on. Anesthesia in horses, while generally safe, can have its complications. And knowing how it interacts with muscle disorders, well, that's really important for their well-being.
Right. And the article jumps right in, starting with Equine Anesthetic-Associated Myopathy, or EAAM. What exactly are we talking about here?
EAAM is basically a complication that affects the skeletal muscles. We see it associated with general anesthesia. And though its prevalence has gone down over the years, probably because of improvements in how we manage anesthesia these days, it's still a concern.
I can see that.
EAAM still accounts for something like 2% of deaths related to anesthesia in horses. And for some procedures, the risk is even higher.
Oh, wow.
Yeah. It's concerning. For instance, about 2.3% of horses undergoing MRI experience EAM, and, get this, a startling 9.2% of those undergoing transvenous electrical cardioversion.
Wow, that's a significant jump. So let's break it down. What's actually happening in the muscles when EAM strikes? What's the mechanism?
It's actually pretty fascinating. The pathophysiology of EAM has similarities to something we call crush syndrome in humans. Basically, you have things like inadequate padding during surgery, the horse being positioned incorrectly, procedures that take a long time, and low blood pressure, all of which restrict blood flow to the muscles. And that lack of blood flow, well, it leads to ischemia.
Ischemia, meaning the tissues aren't getting enough oxygen.
Exactly.
Okay, so I'm trying to picture this. Can you walk me through what happens at a microscopic level, say, if a horse is improperly positioned?
Sure. Let's say a horse is lying on its side, what we call lateral recumbency, for a long time during surgery. The horse's weight ends up pressing down on the muscles, especially those in the limbs on the lower side. This pressure, along with any hypotension from the anesthesia, really restricts blood flow to those muscles. And without enough blood, the muscle cells start to die.
Makes sense. So then when the procedure's over and the blood flow returns, that's when things can get even worse, right?
Exactly. It's what we call reperfusion injury. Basically, when the blood starts flowing back into those damaged tissues, the sudden influx of oxygen can trigger a whole cascade of events. You get the production of harmful free radicals, inflammation, and swelling, all of which actually make the initial injury worse.
So we're talking about a double whammy, essentially.
Right.
First, the lack of blood flow, then this surge of oxygen that causes further damage. What are the red flags that tell us a horse might be developing EAM?
The clinical signs usually show up during recovery or within a few hours after anesthesia. Prolonged recumbency, like they're taking a long time to get up, difficulty standing, and just overall weakness are some early signs. You might also see some muscle twitching or fasciculations, signs of distress like sweating, and even swelling and firmness in the affected muscles.
I see.
Now, the specific presentation can differ depending on how the horse was positioned during the procedure.
Can you give me an example of that?
Sure. Horses positioned on their sides, so in that lateral recumbency, often have issues with the quadriceps, triceps, and masseter muscles on the side they were lying on. But horses positioned on their backs in dorsal recumbency often show damage to the gluteal and longissimus dorsi muscles. In severe cases, you might even see myoglobinuria.
Myoglobinuria.
Yeah, it's when you see that really dark brown or reddish urine. It means myoglobin is being released from those damaged muscles. It's a sign of severe damage.
Okay, so if we suspect EAM, what are the key things we need to do to diagnose it?
First, checking serum CK activity is a must. It usually peaks around 24 to 48 hours after anesthesia. An elevated CK, along with elevated AST levels, is a good indicator of muscle damage. We also need to address any electrolyte imbalances, which are pretty common. And ultrasonography can be helpful to see how extensive the muscle damage is.
So how quickly we act is crucial here.
Absolutely. The faster we intervene, the better the chances of a good outcome. We've got to manage pain, reduce swelling, correct those electrolyte imbalances, and protect the kidneys from potential damage caused by that circulating myoglobin.
Okay, so walk me through that. How do we actually address all of that?
Well, if a horse is having trouble standing, we've got to assist them. We can use things like slings, ropes, or even just encourage them to move as much as they can tolerate. 5-fluid therapy is also crucial. It helps flush out the myoglobin, correct those electrolyte imbalances, and keeps them hydrated.
Okay, that makes sense. And what about medication? What can we use to help these horses?
Well, mannitol, which is an osmotic diuretic, can be helpful to reduce swelling. Cold therapy, like ice packs or cold hosing, can address the pain and inflammation, and dantrolene, a muscle relaxant, can be really beneficial in cases of severe muscle breakdown. And of course, we have to manage pain. We can use NSAIDs, acepromazine, opioids, or regional techniques like epidural analgesia.
So a multifaceted approach is key here. But it seems like prevention is the real game changer.
You're absolutely right. Prevention is paramount. It's a multi-pronged approach that starts with really paying attention to detail during the whole anesthesia process.
What kind of details are we talking about specifically?
Well, proper positioning and padding are absolutely essential. We need to distribute the horse's weight evenly and minimize pressure on those vulnerable muscles. Keeping the anesthesia time as short as possible is another critical factor. And of course, we need to monitor blood pressure closely. We want to ensure that mean arterial pressure stays above 70 millimeter Hg. That can significantly reduce the risk.
Okay, I see. Now, the article also mentioned dantrolene as a potential preventative measure, particularly for those high-risk horses.
Yes, but it's not without potential side effects, so using it prophylactically is a judgment call based on the individual horse and the situation.
Right, so that's EAAM. The article then goes on to discuss hyperkalemic periodic paralysis, or HYPP. Now, this one is hereditary, correct?
That's right. It primarily affects quarter horses and related breeds. It's kind of linked to those breeding practices that have favored more muscular horses. You see a much higher prevalence in halter horses where that heavy musculature is prized.
Oh, that's interesting. I didn't realize that connection. So what's actually causing HYPP? What's the underlying mechanism?
It all boils down to a mutation in a gene called SCN4A. This gene is responsible for a sodium channel, specifically NaV1.4, found primarily in skeletal muscle cells. This mutation disrupts the normal resting membrane potential of the muscle cells, making them more likely to depolarize, which leads to those involuntary contractions.
So if I understand correctly, it's this mutation that sets the stage for the whole cascade of events in HYPP. And these contractions, they're ultimately what lead to the hyperkalemia, right?
Exactly. When those muscles contract, they release potassium into the bloodstream, leading to hyperkalemia, which can have some pretty serious consequences, especially for the heart.
And what kind of consequences are we talking about specifically?
Well, that elevated potassium disrupts the heart's electrical activity, potentially leading to life-threatening cardiac arrhythmias. It's a really serious situation.
Okay, so if a horse has HYPP, how does it typically present itself? What would we see clinically?
Signs usually appear early in life, often during their first exposure to general anesthesia, particularly in recovery. The signs can range from non-specific things, like taking a long time to recover from anesthesia and difficulty standing, to more severe signs, like muscle twitching, rigidity, sweating, a rapid heart rate, high blood pressure, even elevated CO2 levels. And of course, we can see those cardiac arrhythmias we talked about.
Right, that makes sense. Now, it seems like HYPP could be easily confused with MH given they share those symptoms like muscle rigidity and cardiac issues. How do you tell them apart?
There can be some similarities for sure, but distinguishing between the two is super important because the treatments are different.
So let's talk about that treatment. How do you manage HYPP, particularly during anesthesia?
The top priority is managing the hyperkalemia to prevent those dangerous arrhythmias. That usually involves a bunch of things. First, we want to give calcium gluconate for immediate cardiac protection and support ventilation to address respiratory acidosis. We also use low potassium fluids to help dilute that excess potassium in the blood. And sometimes we'll use glucose and insulin therapy, which helps shift potassium back into the cells.
Okay, that's quite a lot to manage all at once.
It can be. And sometimes we need even more. We might have to use sodium bicarbonate and diuretics to lower those potassium levels even further. Figure 3 in the article outlines the specific drugs and dosages typically used for HYPP. It's a really helpful guide.
I'll have to check that out. So is there anything we can do to prevent these HYPP episodes during anesthesia? Anything proactive?
Absolutely. Genetic testing is really important to identify horses that are susceptible to HYPP. For those that test positive, really careful pre-anesthetic management is crucial. That means a low potassium diet, potentially using a potassium-wasting diuretic like acetazolamide in the days leading up to the procedure, and keeping a close eye on their blood gas levels throughout the anesthesia. We want to catch any early signs of trouble.
So it sounds like a lot of preparation goes into this.
It does, but it's worth it. It can really make a difference. Even just acclimating the horse to the hospital environment a few days before can help reduce stress, which is a known trigger for HYPP episodes.
Makes sense. Knowledge and preparation are definitely key when it comes to HYPP. It's not something you can just wing, it seems.
Right. Knowing the horse's genetic background, understanding how the disease works, and having a clear plan for prevention and management, all of that is crucial.
Absolutely. Okay, so we've talked about EAM and HYPP. Now on to the last myopathy discussed in the article, malignant hyperthermia, or MH. The name alone sounds pretty ominous.
Yeah, it can be. MH is a rare but life-threatening pharmacogenetic disorder characterized by a sudden and extreme hypermetabolic state in those skeletal muscles.
Okay, so what triggers MH?
Exposure to certain drugs is the main one. Specifically, the halogenated inhalant anesthetics that are often used in general anesthesia. The muscle relaxant succinylcholine can also trigger it. And even stress and exercise can sometimes set it off.
Right, and I remember reading that in quarter horses, it's linked to a specific mutation in the RAR1 gene.
That's right. This mutation causes dysfunction in the ryanodine receptor. That's a protein responsible for regulating calcium release within those muscle cells.
Okay, so what happens when this receptor isn't working properly? What's the effect?
It leads to an uncontrolled release of calcium into those muscle cells, causing sustained muscle contraction. All of that muscle activity generates a lot of heat, causing the body temperature to skyrocket.
So we're talking about more than just the muscles going crazy. It's a full-blown systemic reaction with a dangerously high fever.
Yeah, exactly. It's a cascade of events that can spiral out of control very, very quickly.
So how do we know if a horse is experiencing MH? What are those clinical signs we need to be looking out for?
During anesthesia, you might see a progressive increase in end-tidal and arterial CO2 levels, even with adequate ventilation. Usually, it's accompanied by rapid breathing, high blood pressure, and a racing heart rate.
So some overlap with the HYPP there.
Yes, some, but with MH, the clinical picture is usually much more severe and progresses rapidly.
Okay, I see. So what else might we see?
Well, you might see excessive sweating, protrusion of the third eyelid, muscle rigidity, muscle twitching, and sometimes even myoglobinuria. And here's an interesting thing. You might actually notice that the anesthesia equipment is warm. That's because of all the heat generated by the uncontrolled muscle activity.
Wow, that's pretty incredible. So what would we see in the lab work?
The blood work might show hemoconcentration, meaning the blood is thicker than usual, electrolyte imbalances, elevated lactate levels, and acidosis. CK and AST levels will also usually be elevated.
So based on how rapidly fatal MH can be, early recognition and intervention are critical here.
Absolutely. Early recognition is vital. Unfortunately, even with aggressive treatment, the prognosis can be pretty grim.
So what are the emergency steps we need to take if we suspect MH?
First and foremost, stop giving any of those triggering agents. That usually means discontinuing the inhalant anesthetic right away.
Okay, get that out of their system.
Ideally, we'd switch the horse to a completely different anesthesia machine. That gets rid of any residual anesthetic gas. Then we want to get them on 100% oxygen and adjust their ventilation rate to manage those high CO2 levels. We can use injectable anesthetics to maintain anesthesia while the inhalant anesthetic clears.
Okay, makes sense. And we talked about dantrolene earlier. How does that fit into the picture here?
Dantrolene is really important. It's a skeletal muscle relaxant that counteracts those out-of-control muscle contractions causing the hyperthermia. The article actually has the recommended dosages for both intravenous and nasogastric administration.
I'll have to take note of that. So what else do we need to do?
Active cooling is crucial. We might use ice packs, cold water baths, even gastric lavage with cool fluids. And of course, we need to monitor blood gas levels, electrolytes, and acid-base status. We'll need to manage any imbalances, especially hyperkalemia.
This is like a whole team effort to manage MH.
It really is. It can be incredibly demanding. And even if you can stabilize the horse during that initial episode, you need to be vigilant during recovery. They can have some really violent movements and injure themselves.
Okay, so just like with EAM, prevention is key, especially knowing those trigger agents.
You're exactly right. Genetic testing is available for MH susceptibility, and if a horse tests positive, those trigger agents should be avoided completely. The article suggests total intravenous anesthesia, which is a safer alternative.
And what about dantrolene as a preventative?
We can definitely consider it, especially in those high-risk cases. But there's not much evidence to support prophylactic use in horses. The key is having a clear plan in place before you even start anesthesia. You'd want to take steps to prevent hypothermia using warming blankets, heated fluids, and a warm recovery environment.
So managing anesthesia in horses with EMND is all about anticipating and addressing those unique challenges, particularly with breathing and temperature regulation.
Exactly.
Okay, so we've covered PSSM and EMND. Are there any other pre-existing muscle disorders that can create problems for anesthesia?
The article briefly mentions atypical myopathy.
Atypical myopathy is a rare condition, but often fatal. It causes a sudden onset of muscle weakness and breakdown. Is that right?
Yeah, that's it. It's usually linked to ingesting certain toxins, especially those found in sycamore trees.
Oh, interesting. So how does atypical myopathy affect anesthesia?
Well, even if a horse has recovered from atypical myopathy, they might still have some lingering muscle weakness. This can make them more sensitive to those muscle-relaxing effects of anesthetic agents.
So similar to PSSM in that regard.
Yeah, there are definitely some parallels, both in terms of that increased sensitivity to the drugs and the potential for myoglobinuria.
So it would follow the same principles of carefully selecting drugs, adjusting dosages, and closely monitoring them.
Exactly. And it's important to remember that these horses might have underlying heart problems too, so keeping a close eye on their heart function during anesthesia is super important.
It sounds like managing anesthesia in horses that have had atypical myopathy is all about being aware of those potential long-term effects and planning the anesthesia around them.
Right.
Okay, so we've talked about PSSM, EMND, and atypical myopathy. Are there other pre-existing muscle disorders that can impact anesthesia in horses?
The article doesn't really go into detail about other specific conditions, but it really stresses considering any underlying muscle disorder when planning anesthesia.
So even if it's not one of those classic myopathies, any muscle issue could affect things.
Exactly. That's why it's so important to do a thorough pre-anesthetic assessment. We need to know everything we can about their medical history, any past episodes of muscle weakness, soreness, anything like that. And of course, we want to know about any medications they're currently taking.
And would there be cases where it would be helpful to consult with a specialist?
Oh, absolutely. If you're unsure about the potential risks or the best way to approach a particular case, it's always best to be cautious and reach out to a specialist for advice.
So when we're talking about anesthesia in horses with pre-existing muscle disorders, it's all about that individualized approach, careful planning, and really understanding how complex these cases can be.
I couldn't agree more.
Okay, so we've covered a lot of ground in this section, looking at those specific challenges with PSSM, EMND, atypical myopathy, and other underlying muscle disorders.
Right. We've emphasized how important it is to be aware of those conditions, choose the right drugs, adjust those dosages appropriately, monitor them carefully, and provide good supportive care.
And we talked about that need for collaboration between the veterinarian, the horse owner, and any specialists who might be involved.
Hopefully, this part of our deep dive has given everyone a better understanding of how to approach anesthesia in these more complicated cases.
It definitely has. Now let's move on to the next part of the article, which looks at some practical tips for handling anesthetic emergencies in horses with muscle disorders.
This is where things get really intense. We're talking about life or death situations that require us to think on our feet and act fast.
Okay, let's jump into the world of anesthetic emergencies. The article starts by talking about the dreaded cardiac arrest scenario.
Cardiac arrest is when the heart suddenly stops working. It's a true medical emergency that needs immediate intervention. There's no time to waste.
So how do we know if a horse is experiencing cardiac arrest? What are the signs?
The most obvious sign is no heartbeat. The horse might also collapse, stop breathing, and lose consciousness.
Sounds pretty dramatic.
It is. And time is absolutely critical. Every second counts.
So what do we do first if we're dealing with cardiac arrest? What are those initial steps?
The absolute most critical thing is to start CPR immediately.
CPR, is that the same technique used in humans?
It's based on the same principle, but there are some differences in how we do it on a horse just because of their size and anatomy.
So what does equine CPR actually involve?
It usually involves a combination of chest compressions and artificial ventilation. We're trying to get that heart pumping again and get them breathing.
Chest compressions on a horse. How do you even do that?
Well, you usually stand on the horse's left side and use your body weight to compress the chest wall over the heart.
Sounds like a workout.
It is. It definitely takes a coordinated effort from multiple people.
And what about the artificial ventilation part? How do we do that?
We can use a bag valve mask device or an endotracheal tube to get those breaths into their lungs.
So it's a really intense, coordinated effort to get that heart going again and restore their breathing.
It definitely is. And while the success rate for CPR in horses isn't very high, it's still their best chance of surviving a cardiac arrest.
So it's always worth trying, even when the odds are stacked against you.
Absolutely. Never give up hope.
Aside from CPR, are there any other things we might need to do during a cardiac arrest?
Yeah, we might need to give medications, things to help stimulate the heart, correct any electrolyte imbalances, or even control seizures if they happen.
So it's a multi-pronged approach.
Mm-hmm.
Address the immediate cardiac problem while managing those contributing factors.
Exactly.
Okay, so cardiac arrest is one major emergency. What other anesthetic emergencies might pop up in horses with muscle disorders?
Another potentially life-threatening one is malignant hyperthermia, or MH, which we talked about earlier.
Right, that rare but very dangerous condition where their body temperature spikes really high.
That's it. And it can happen really fast, often with very little warning.
So how do we manage MH when it happens?
The most important thing is to recognize those signs early on and act fast.
What signs are we talking about specifically? What should we be on the lookout for with MHE?
You might see a sudden spike in their end-tidal CO2 levels, a racing heart rate, muscle rigidity, and, of course, that dramatic increase in body temperature.
So it's pretty clear-cut when it's happening.
It is, and the longer you wait to do something, the worse the outcome is likely to be.
So what steps do we take to manage an MH episode?
First, we need to stop giving them any of the drugs that might be triggering it. Usually that means discontinuing the inhalant anesthetic immediately.
Makes sense. Get rid of the source of the problem.
Right. And then we have to cool the horse down as quickly as we can. We might use ice packs, cold water baths, even do gastric lavage with cool fluids.
And dantrolene comes into play here too, right? We talked about it earlier.
Yes, dantrolene is really important. It's a muscle relaxant that can counteract those uncontrolled muscle contractions that are causing the hyperthermia.
Okay, so it's a crucial part of the treatment plan.
It is. And we might also need to provide supportive care like fluids, oxygen, or even mechanical ventilation.
It sounds like a really intense and difficult situation to manage.
It definitely can be. You really need the whole veterinary team working together to handle it effectively.
Okay, we've talked about cardiac arrest and malignant hyperthermia. Any other anesthetic emergencies we should be aware of in these horses?
Well, while it's not exactly an emergency in itself, myoglobinuria is a possible complication that we need to manage very carefully.
Right, myoglobinuria. That's when you see myoglobin in the urine, which can be a sign of muscle damage.
That's right. It can happen in any horse under anesthesia, but it's more common in horses with pre-existing muscle problems or those that have been lying down for a long time or had low blood pressure during the procedure.
So how do we usually manage myoglobinuria?
The goal is to prevent kidney damage, which can happen when myoglobin builds up in the kidneys. The main treatment is aggressive fluid therapy to flush out that myoglobin and make sure they're producing enough urine.
So we're supporting the kidneys and helping them get rid of those harmful byproducts from the muscle breakdown.
Exactly. And sometimes we might also need to give medications to help make their urine more alkaline. That helps prevent the myoglobin from forming solid deposits in the kidneys and causing damage.
Okay, so fluids and medications to protect the kidneys.
You got it.
We've discussed cardiac arrest, malignant hyperthermia, and myoglobinuria. Are there other anesthetic emergencies specific to horses with muscle disorders?
Not really specific to them, no, but there are a few other general anesthetic complications that can crop up in any horse, things like respiratory depression, hypotension, and anaphylactic reactions.
So even in healthy horses, anesthesia always has some risks.
Absolutely. That's why it's so important to be prepared and have a well-trained veterinary team.
Okay, let's recap those key points about anesthetic emergencies. We talked about cardiac arrest, which requires immediate CPR and supportive care.
Right. And then there's malignant hyperthermia, where we need to stop those trigger agents right away, cool them down aggressively, and give dantrolene.
And then we have myoglobinuria, which we manage with fluids and medications to protect the kidneys.
And we touched on those general complications like respiratory depression, low blood pressure, and allergic reactions. Being vigilant and prepared is key no matter what.
It's all about being aware of those potential problems, having a plan to deal with them, and knowing how to respond quickly and effectively if something does go wrong.
Exactly. And it really underscores how crucial it is to have a well-trained and experienced team that can work together seamlessly in a pressure situation.
I totally agree. Now, before we wrap up this part of our deep dive, let's go back to that clinic's care points section one last time. They really boil down the key takeaways of this article, into actionable advice.
They really do. They're packed with practical tips for anyone managing anesthesia in horses.
Okay, let's go through them. The first one emphasizes that EAM is something to watch for in any horse undergoing general anesthesia.
It's a great reminder. EAM can happen even in horses that seem perfectly healthy, so we can't get complacent.
And the second point focuses on those preventative measures for EAM proper positioning, adequate padding, and keeping that mean blood pressure above 70.
Those are the basics, but they're so effective. Doing those things right can really reduce the risk of EAM.
The third point zeroes in on those suspected inherited myopathies.
Yeah, it recommends holding off on elective procedures and doing genetic testing when possible. It helps confirm the diagnosis and guide how we manage their anesthesia.
Makes sense. If you know a horse has a genetic predisposition, you can take those specific steps to minimize the risks.
Exactly. And then the fourth point reinforces how important it is to build those preventative measures into every single anesthetic plan.
So being proactive, not reactive.
That's it. Anticipate those problems rather than waiting for them to happen.
And finally, the last point stresses that knowing the clinical signs of those different myopathies is crucial.
Early recognition is so important for successful treatment. The quicker you recognize it, the better the chances of a good outcome.
So these clinics' care points emphasize vigilance, preparedness, and a proactive approach to anesthesia in all horses, especially those at risk for myopathies.
They're great reminders for clinicians, helping them provide the safest and most effective care for their equine patients.
We've covered a ton of ground in this deep dive, exploring that complex relationship between anesthesia and myopathies in horses.
We've delved deep into EAM, HYPP, and MH, looking at their mechanisms, presentations, and how to manage them.
We've talked about that pre-anesthetic assessment, tailoring the anesthesia plan, monitoring carefully, providing supportive care, and clear communication with the owner. All of it.
We even got into those anesthetic emergencies, which require quick thinking and action.
And those clinics' care points have been our guideposts, offering practical takeaways for everyone.
I hope this deep dive has given everyone a better understanding of this challenging topic and empowered them to advocate for the best care for these amazing animals.
Absolutely. Now, before we wrap up, is there anything else from the article that you think is worth mentioning?
Yeah, there's one passage that really stood out to me. It says that choosing the anesthetic protocol for horses with myopathies should be based on the specific myopathy, the individual horse's needs, and the clinician's experience.
That's a great point. It highlights the importance of a tailored approach, considering all those individual factors. There's no one-size-fits-all answer for managing anesthesia in these horses.
Exactly. We need to be able to draw on our knowledge, our experience, and our judgment to make the right calls for each patient.
Okay, let's take a look at the figures and tables in this article. They seem to be packed with info, presented in a really clear way.
They are. Should we start with Figure 1?
Sure. Figure 1 gives us a really helpful algorithm for recognizing and managing anesthetic-associated myopathy. It's a step-by-step guide, from when we first suspect myopathy to the diagnostic workup and treatment options.
I think it's really practical. It lays out the decision-making process so clearly. It's a great tool to have, especially for those who might not be as familiar with these conditions.
Absolutely. Now let's look at Figure 2. This one shows us how to position and pad horses properly for general anesthesia.
It's a great visual reminder. It highlights those key pressure points and shows how to use padding effectively to distribute the horse's weight and avoid those pressure points.
I think it's particularly helpful for those who are still learning and need those visual cues.
Yeah, I agree. It can make a big difference in preventing complications.
All right, let's move on to Table 1. This one gives a comprehensive overview of the anesthetic agents commonly used in horses, along with their potential effects on skeletal muscle function.
This is a really handy resource. It's a quick reference to help choose those safer anesthetic agents for horses with muscle disorders.
It breaks down each agent and tells us whether it's safe to use, if we need to adjust the dosage, and any specific precautions to keep in mind.
It's like a cheat sheet for clinicians.
Exactly. Okay, Table 2. This table summarizes the key clinical and lab findings for those three main myopathies: EAM, HYPP, and MH.
This one's super helpful for distinguishing between those conditions, especially when the signs might overlap.
It outlines those key differences, like when they usually appear, those characteristic signs, and what we expect to see in the lab work.
It's a great tool for both diagnosing and deciding on the best treatment.
And finally, Table 3 focuses on managing hyperkalemia in those horses with HYPP.
This one gives a clear summary of the different treatment options for hyperkalemia. including specific drug dosages and how to give them. It's perfect for clinicians who need to act quickly in a HYPP crisis.
It also stresses the importance of watching those serum potassium levels carefully and being ready to step in if they start to climb.
Absolutely. Early intervention is key for managing hyperkalemia and preventing those really scary heart problems.
So we've gone through the figures and tables, and they really add to our understanding of managing anesthesia in horses with muscle disorders.
Totally agree. They make the information easier to grasp.
Before we move on, I just want to say, make sure you're familiar with these figures and tables. They're really useful for anyone working with horses under anesthesia.
I couldn't agree more. Having that info on hand can make all the difference when you're dealing with these complex cases.
All right, let's move on to the last part of the article, which focuses on some case studies that really bring these concepts to life.
Case studies are great. They show us how things play out in real-world situations.
Exactly. The first one is about a horse with a history of HYPP that needs a routine dental procedure.
This case really highlights the importance of careful pre-anesthetic management in horses that we already know have myopathies. It goes into how they took steps to prevent a HYPP episode, like putting the horse on a low-potassium diet for a few days beforehand and watching those electrolyte levels closely during the procedure.
Right. And it also shows how important it is to have a plan ready in case hyperkalemia does happen. The case described how they had all the meds and equipment ready to go just in case there were any complications.
It's a perfect example of a proactive approach leading to a good outcome, even in a horse with a potentially tricky condition.
Now, the second case study is about a horse that developed EAAM after a long surgical procedure.
This one really drives home the importance of those basic preventive measures.
Yeah, it describes how the horse was in the same position for too long without enough padding, which cut off blood flow to the muscles and caused damage.
It's a reminder that even seemingly small things like positioning and tatting can have major consequences if we don't get them right.
It also shows how tough it can be to manage EAM once it sets in. The horse had a really long recovery, and they needed a lot of intensive care to get its strength and mobility back.
It's a sobering example of how severe EAM can be and why we have to do everything we can to prevent it in the first place.
The third case study is about a horse that went into malignant hyperthermia during a routine castration.
This one's really dramatic because it shows just how fast and unexpectedly MH can happen.
Yeah, it says the horse was doing fine under anesthesia at first, and then suddenly their temperature spiked, they got muscle rigidity, and their heart rate went through the roof.
It really highlights the importance of recognizing it early and intervening quickly.
The case study goes into detail about how the team cooled the horse down, gave dantrolene, and provided all that supportive care.
It shows how crucial it is to have a clear protocol for MH and be ready to act fast.
So these three cases, even though they're all different, they all highlight those complexities and risks of anesthesia in horses with muscle disorders.
They're great reminders of the importance of those key things we've been talking about: being vigilant, prepared, individualizing care, and working together as a team.
Couldn't agree more. Any other thoughts about these case studies before we move on?
Yeah, I think it's important to remember that these cases aren't meant to scare us. They're meant to be learning opportunities.
Right. They're real-world examples of what we might face and how we can deal with it.
Exactly. They give us a look into what other clinicians have done and let us learn from both their successes and their challenges.
Okay, so let's take a look at the article's concluding remarks.
The authors really emphasize the importance of understanding how anesthesia and muscle disorders in horses are connected. They stress that this knowledge is crucial for minimizing those risks and getting the best possible outcomes.
And they point out the need for more research in this area, particularly in developing new anesthetic agents and techniques that are safer for these horses.
That's a critical point. As we learn more about these conditions, our approach to anesthesia has to keep evolving, too.
Absolutely. Before we wrap up, what are some key takeaways you think are important for our listeners?
The biggest takeaway is that anesthesia in horses with muscle disorders is complex. It requires scientific knowledge, clinical experience, careful planning, attention to detail, and, most importantly, a real commitment to the well-being of the horse.
I think it also highlights how important it is to stay up to date on the latest information about these conditions.
Absolutely. Veterinary medicine is always moving forward, and we have to keep learning to provide the best possible care.
Okay, so that wraps up our deep dive into anesthesia and myopathies in horses.
It's been a really fascinating discussion.
I agree. I feel like I have a much better grasp of the complexities of anesthesia in these horses now.
Me too. Hopefully our listeners do too.
All right, let's tackle the last part of this article. It focuses on those breed-specific anesthetic considerations. Some breeds just have those unique quirks we need to be aware of, right?
Exactly. They might have certain predispositions or sensitivities to the anesthetic agents or even the procedures themselves.
Okay, so the article starts with draft breeds, those gentle giants. What do we need to know about anesthetizing them?
Well, the article points out the challenges with their size, especially when it comes to positioning them, ventilating them, and figuring out the right drug dosages.
Makes sense, they're massive.
Yeah, it emphasizes using the right-sized equipment, which might seem obvious, but it's easy to overlook. And we need to calculate drug dosages based on their lean body weight, not their total weight.
Oh, that's interesting. Why is that?
Well, those big draft horses can carry a lot of extra weight, but that doesn't necessarily mean they need more of the drug. We're looking at their metabolically active tissues.
Makes sense. Anything else specific to draft breeds?
Yeah, the article cautions against using alpha-2 agonists like xylazine or dotamidine as the only anesthetic agent.
Why is that? What's the issue there?
Draft breeds seem to be more sensitive to those cardiorespiratory depressant effects. They can have really slow heart rates and low blood pressure, which can get pretty dangerous.
So it's all about recognizing those breed-specific sensitivities and adjusting the anesthetic plan accordingly. All right, what about thoroughbreds? They're those high-strung athletes.
Yeah, the article talks about their athleticism and, their sometimes, shall we say, spirited temperament.
Right. Thoroughbreds are known for their sensitivity to stress. How does that affect their response to anesthesia?
They might need higher doses of sedatives and pain meds just to get them adequately sedated and keep them comfortable.
And does that stress make them more prone to problems afterwards?
It can. They could be more likely to develop post-anesthetic myopathy, particularly if they struggle or get worked up during recovery.
Okay, so how do we manage that?
It's all about keeping things calm and quiet throughout the whole process, from the initial handling to the recovery period. We want to make sure they're in a comfortable, stress-free environment.
Okay, that makes sense. So we talk about draft breeds and thoroughbreds. Any other breed-specific things we need to be aware of?
The article mentions miniature horses.
Oh yeah, minis. They're becoming more and more popular as pets.
Yeah, they are. And the article points out some challenges unique to them.
Like what?
Because of their size, intubation and ventilation can be tricky. Plus, they have a larger surface area to volume ratio, which means they lose heat more easily.
So keeping them warm during anesthesia is critical.
Absolutely. And they might need lower drug dosages to get the desired effect.
It seems like a recurring theme here is to recognize those breed-specific differences and adjust accordingly. Okay, now the article also talks about geriatric horses.
Right. Geriatric horses, just like older people, often have their own set of challenges. They might have underlying health issues, decreased organ function, and less ability to handle stress.
So what are the key considerations when anesthetizing a geriatric horse?
The article really stresses the importance of doing a thorough pre-anesthetic evaluation. We need to catch any potential risks and make sure they're as healthy as possible before we even think about anesthesia.
And how do we tailor the anesthesia for an older horse?
Well, they might need more fluids to support their heart and circulation, and we might need to take things slower with their recovery, watching them more closely and providing extra support.
And the choice of drugs probably matters too, right?
Definitely. We'll often choose agents that have minimal effects on their heart and lungs.
So a more cautious and conservative approach with these older horses is best. Now, what about pregnant mares?
That's a really interesting one. Anesthesia in pregnant mares is all about balance. We've got to keep both the mare and the foal safe.
I can imagine. So what are the big things to keep in mind?
The article stresses minimizing stress and avoiding certain drugs that can cross the placenta and potentially harm the foal.
Okay, so drug choice is crucial. Anything else?
Yeah, it also talks about the risks of having them lying down for too long, especially later in the pregnancy.
Why is that?
That prolonged pressure on the major blood vessels can restrict blood flow to the uterus, which can lead to fetal distress.
So the shorter the anesthesia, the better, and positioning is critical too.
Exactly. We want to make sure there's no unnecessary pressure on the abdomen, and we need to keep a close eye on both the mare and the foal during the whole process, looking for any signs of trouble.
Right, so vigilance is key with these mares. Now, I see the article wraps up by talking about the importance of research and education in this field.
Yeah, they really emphasize the need to keep learning. We need to keep researching those underlying mechanisms of these conditions and develop new anesthetic agents and techniques that are even safer for these horses.
And it sounds like they're really pushing for collaboration between researchers, clinicians, and the industry.
Absolutely. The more we can all work together, the better care we can provide for these horses.
Well, I think that brings our deep dive to a close. We've covered a lot, haven't we?
We have. It's been a really interesting journey.
I've definitely gained a new appreciation for the challenges and the rewards of working with these incredible animals, especially when it comes to anesthesia.
Me too. And hopefully our listeners feel the same.
I'm sure they do. And with that, from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.